Thank you so much. This was brilliant. Absolutely brilliant.
It was wonderful,
so much.
wonderful, wonderful.
Thank you so much. So this was a very powerful performance by this group. Performance is Rhythms of Manipur. If I may ask you a question on the inspiration that you draw, who can I speak to? Who would want to talk about this? Huh? Okay. Huh? Anyone who wants to talk? Huh? Yeah. Yeah. Sure. Nobody wants to talk? Wow. Please come. Please come. Hi, good evening.
Good evening.
So fantastic performance. I just wanted to know, where do you draw this inspiration from? I believe a lot of this has to do with nature. I've seen many videos from Manipur, from the floating circles.
Right. Loktak Lake, it is called Loktak.
Yes,
Yeah.
exactly.
One of the only natural lake in the northeast is Loktak Lake.
Correct.
Yeah.
So would you like to tell us about the inspiration for this music?
It is way back in 1985 we started this as a music school, but we incorporated the ladies drummer around 7 years back. And we also work with the environmental issue also. We have been composing various music composition based on nature and other drums. Welcome, sir.
Congratulations,
Thank
fantastic.
you, sir. Thank you, sir.
Fantastic, wow.
Yeah. You were saying compositions
God
on
bless
nature.
you. God bless you.
Various
Thank you.
composition we have been doing for the last 37 years. We have been now 37 going on, established way back in 1985 in the valley of Manipur, Imphal.
Okay. One thing that I wanted to talk about, and I have learned that these instruments of yours are completely biodegradable. Right? So obviously there's no element of plastic at all in these instruments.
Yes.
Talk us through this, because now most of the modern instruments, for the sake of durability, have lots of plastic in them.
Right.
But that's not the case with these instruments.
Yes, we have all natural.
So what is this made of?
It is from a cow skin.
Okay.
And the plastic elements also not produce original sound like that.
Yes. Doesn't sound authentic.
Right.
Where have you been?
Also, we're opening this so that
It's
we can
like
see.
bamboo.
No, it is wood called wang. It
And
is
what is this made from?
wang. It's called in wang. It was grown in our mountains.
Okay.
This is our own product.
Brilliant.
Wonderful.
Fantastic.
Wonderful.
You want to
Fantastic.
meet Mr. Bachchan? He's there.
Welcome, sir.
Go there and meet him. Go there, shake hands.
I'm part of your group. I was singing with you. You didn't notice me.
Sure, sir.
You want to meet
I
him?
have a
Go
few-
meet him.
You know,
Few
I have an
lines.
idea. Mr. Bachchan, do you know that this is completely biodegradable?
Oh, wow.
Yeah. So there is no element of plastic. This is completely biodegradable. And maybe one of you can play this for him.
It's
It's got beautiful resonance.
Right.
Yeah. Why don't you give a few sticks to Bachchan
also-
Sahab also?
Yeah, on the other side.
You can ask him to play also.
I don't know. I can't remember.
Can join little bit. Matiam tang chilo.
Yeah, please.
For your information, we have also won the two national awards.
Wow, fantastic.
own
You can
composition.
tell it's so good, yeah.
Right.
Very good.
Thank you, sir.
Fantastic. Thank you so much.
Thank you.
Please come.
You said you wanted to do it on his head now? Same sound. Hollow.
Empty.
Before you said it about me, I quickly...
So also doing some journalism work.
Oh, good.
I also MEAU.
Oh, how kind of you. Thank you, thank you, thank you.
I'm doing some leadership work.
That was a marvelous, marvelous performance. And it's so great that it's all been inspired by nature. And we've just talked about how important nature and environment is for human health. We are now going on to our next topic, which is essentially, we're going to look at how we can all step into the future together. If we want to achieve our goal of holistic good health for every Indian, to increase the average life expectancy to 80 years of age, at present it's about 71 years, we can only do it is if we as individuals, civil society, corporates, not-for-profits, healthcare experts, and healthcare volunteers and workers and the government come together. Health cannot be a privilege, but must be the right of every Indian. So to talk about this, we are joined by R.S. Sharma, who's the CEO of the National Health Authority. Sir, thank you so much for joining us. You've created, or you're looking after, a new integrated unified health platform. And this unified health interface has been created. How does this actually work?
And the idea has come basically from the unified payment interface. Now, what that means? That means is that we want to have a complete interoperability. Like in unified payment interface, you are able to transfer money from any bank to any bank, from any bank to any wallet, and stuff like that, to any bank, to any person also on telephone number or whatever. So this is the basic issue, that we are creating a framework where anybody could be able to search for doctors, search for laboratories, search for ambulances, search for blood banks, using the same standard API, and then could get the results, and then he could book those facilities, whether it is an ambulance or whether it's a test, diagnostic test, or whether it's a doctor, or whether it is actually booking an admission in the OPD of any hospital. So that essentially is the next part. And then finally, it should be able to avail the services, which is that you can do teleconsultation, you can go there and get the vaccination done, or donate the blood. So basically, we are talking of interoperable telecommunication. We are talking interoperable commerce, purchasing of medicines. We are talking of interoperable booking of let's say, slots in the hospital or ambulance and things like that. That is the overall comprehensive framework, which essentially will actually enlarge the availability of services to everybody without everybody downloading these applications.
So the CoWIN app, sir, was created for the COVID vaccines, and now there is a plan to repurpose it for all of the vaccinations and even for blood and organ donations. How will this roll out?
Absolutely. I think this is also a part of the same health stack. Essentially, let's say what happens is that what does CoWIN do? CoWIN provides for the citizens, it provides services to locate the vaccination centers. It provides services to provide the information as to where are the vacancies available, which vaccination center is providing which vaccination, let's say, whether it is Covishield or Covaxin and stuff like that. And then from the hospital's point of view, hospitals are able to publish their vacancies, their timetable, their time schedules. And then from citizens' point of view, they are able to download the certificate. From the vaccinator's point of view, they are able to identify a person and vaccinate, right? These are all the stakeholders, the vaccinator, the hospital, the patient. Now, what we are saying is there is fundamentally no difference between the COVID vaccination and the immunization vaccination. It's essentially expanding the scope and repurposing CoWIN for doing those kinds of things also. Wherever you have a demand, where you have a supply, and then you can make them meet and you can provide information to the seekers in a transparent basis, and then provide them facility to book and provide them facility to basically approach and get the vaccination done.
So, but while it's important that our health access becomes digitized, in India we have so many vulnerable groups, like a lot of our tribal groups who are so marginalized, as we heard from the Mushahars earlier today. So how will they have access to this? I mean, they're the people who probably need the greatest access to medication, medicines, good healthcare. So how will they access this technology?
No, first of all, that's a very, very, very good question, Swati. And I think the answer to that is as follows. India is an extremely diversified country, diverse country. And what is happening is that we need to have any solution which is there, rolled out digital solution, that has to be inclusive. So, for example, we have in COVID, we had the system of prior registration, but we also had the system of walk-ins, where people would come and then they could get digitally, sort of vaccinated and digital records created. So basically, and we also have assisted places. We have the common service centers at the village level, which provides these kinds of small digital services to the people. And fortunately, now we have mobile numbers, at least feature phones to everybody. And like in COVID, we had said that on one account, there can be 6 family members who can basically create an account and create the records, etc. Similarly, we will have this also. It's not necessary that everybody who is doing it has to have a smartphone. There could be one member in the family who has a smartphone, and then every family member could come into that.
Ram Sevak Sharma, thank you very much for joining us. And now I would like to introduce the Chief Minister of Manipur, Mr. N. Viren Singh, is now with us. J.V. Prasad Rao, former Union Health Secretary, is also going to join us. We'll have more guests also joining us in just a short moment. But Viren Singh ji, I want to begin with you first and ask you on health as a subject matter of priority for you as a Chief Minister in your state. Because usually what is seen is that chief ministers and governments talk a lot about it, create the right noise, but in terms of budgetary allocation, we don't see a great deal being done.
You see, our priority is on education and health sector. During my first term, in the last 2017 to 22 February, that you might have seen that what we launched and initiated for the welfare of, particularly in the health sector. Thus, we launched the Chief Minister ki Lakshya ki Tangbang, means the health schemes for Chief Minister. Means we do provide rupees 2 lakh to each and every household under the below poverty line to get free medication, free treatment in the state hospital, including some of the outside hospital who is penalized. So, now already out of, 6 lakhs houses altogether in the state, we have distributed, provided the health card of 5 lakhs is to every, about to 4 household in the state. Means 70% of the total population has been covered. And above this, we also launched the Health for Old. Health for Old means our teams, including with doctors, nurses, ASAs, we are sending village to village. And we are taking up 10 diseases like breast cancer, BP, diabetes, etc., etc. Out of this 10 in category. And we do tests there in their own home. And we provide medicine to them freely. Now, till today, we have already covered 2.5 lakhs people, house-to-house campaign, and around 600 villages has been covered now. And you see, in the most of the district hospitals, Manipur is a hilly terrain area, very difficulties area which could not reach through vehicles, motorable road is not there. But even then, we have established, e-technology, e-televised treatment through at various district headquarters. And in some three, Chorchanpur, one this Tamenglong district, and Sandil district has been provided 24/7 power through solar power. Like this, we are doing our best in the health sector. Just I want to say, and I want to keep in front of you.
Mr. Biren Singh, this is Amitabh Bachchan. So we've just heard you and really appreciate some of the statistics that you have enumerated just now. I just have a very, not a personal question, but sort of very distinct. Whenever you announce these statistics, is there a methodology where you can actually monitor the kind of information that you have passed through the e-network to see that it is being implemented?
First of all, Bachchanji, namaste. So
Namaskar.
for being privileged to have discussed dialogues with you directly. Exactly under the leadership of the Honorable Prime Minister Narendra Modi ji, just digital facilities has been provided all over the state, except 5-10% left. Otherwise, 90-95% has been covered, sir. And just this data has been, I have my own one dashboard in my office, which is connecting directly to the district, all the district headquarters and the CMOs. So day-to-day development and the problems can be available in my office easily, sir.
No, I just asked this question because when we were doing the polio campaign, we didn't have the technology benefit with us.
Right.
And there were these workers who used to go into the deep forests and very difficult terrains personally, crossing rivers and forests and delivering these drugs and these do boon zindagi ke. And that was a personalized kind of information that we used to get. But now, as you rightly say, if you have some kind of technology that reports back to you, I was just wondering how authentic it is, because at the end of the day, it's not just the statistics, but to see how many people actually benefited from them.
Exactly. Can you hear me?
Yes, we can, yes.
Okay. This digital platform, which have expanded to the all over the state district headquarters, and we are monitoring through our head office also. Delhi, we are asking, and even I just mentioned about the Health for All. Health for All, we are sending our teams from village to village, and they are checking their health situation, entering inside their homes, and from that particular village also, we are able to receive the exact, if there is any serious patient, then by virtual, the patient can talk to the senior doctors who are staying in the Imphal hospital. That kind of facility also we provided. Yeah. So just we are feeling easy to deal in such a manners.
Yeah.
I would like to say
my reason for asking this was because through the e-technology you can monitor what has been delivered, but can you get a response from the person to whom it has been delivered? And that would be a very exact moment.
Yeah, very genuine question. Sometimes monthly I do interact with even with the patient through the virtual. Just our doctors, our nurses will go directly to the patient, and the patient will be able to speak directly to me. Yeah. So that through virtual. That kind of facility also we are able to provide under the Honorable Prime Minister Narendra Modi's guidance.
That's very critical. That's very critical.
And we are also established one platform, CM the High C, giving a free telephone call and they can complain anything to me in my name. Same I say, falana, we want this, we want it. Then my team will automatically respond. And if there is any seriousness, then my team will directly bring me the call and I will talk to them.
Wonderful.
That is
Well done.
very much. Okay.
Sir, this is Pranoy Roy, sir. Thank you very much for joining us. It's a great honor. So as you know, we are focusing on two big things here. One is health of children and general health care in our society. And we just want to ask you to say yes to two things, which we're going to ask all chief ministers, but Manipur can lead the way if you say yes. One, please commit to increasing the budget expenditure on child health care by just 15% every year. A year, 15%, which means in 5 years you'll have doubled it, which is a big step, and you'll lead the way in India. And secondly, will you increase the number of ASHA workers from whatever it is in 5 years to 5 times what it is now, and give them a slight increase in their, not a slight, an increase in their income. These two commitments, if you can make, you will lead India. We're going to get all chief ministers to commit to this much: child health care and ASHA workers.
Rohiji, very, very thanks for talking directly in a meeting with you.
Thank you, sir.
Why not? Why not? We are giving priority to the children. Children is our futures. And just we are having, the shortage of revenue as a small state, even though just we are encouraging, we are prioritizing in the health and education, and surely we will increase that kind of
Thank you, sir.
Budget also.
That's
And,
great to hear. Great to hear that. Thank you very, very much. Thank you. Thank you.
And the second question is about ASHA.
ASHA workers. Yeah.
You rightly mentioned ASHA, they are not getting much payment, only 1,000. Earlier it was, their honorarium was hardly 500 only.
Yeah.
But now we have increased to 1,000. And their working style is so, commendable, sir. Commendable.
Really?
Thus, during the COVID, they're never afraid and they doesn't care of anything. And they do go wherever the patient is there. Wherever the government asks, they will go. They sacrifice. And definitely, the government has already we have increased their remuneration. And again, I assure you, they are the only people who are working in the fields. We have to encourage them. You are rightly pointed out.
Thank you, sir. Thank you. You will lead the way in this. Thank you.
Thank you. Thank you very much.
Thank you so much, sir. Thank you.
Thank you so much, Mr. N. Biren Singh, the Chief Minister of Manipur. We also have Mr. J.V. Prasad Rao. Mr. Rao, as a former health secretary, what do you see as India's main challenge in the road ahead to attain Sampoorn Swasth?
I think the road to Sampoorn Swasth lies in keeping people at the center of the response. See, it should be people-centered health, not facility-centered health. Unfortunately, even until now, when we talk about health centers, hospitals, doctors, nurses, etc. But if you have to put the people at the center, and if you talk about universal health coverage as your objective, we should see how we can reach the facility to the last mile, to the people who are deprived, to the people who are marginalized, who are far away in the jungles, and also who are stigmatized and criminalized, like the gay population, the men who have sex with men, the sex workers, and so many others. And today, as Amitabh rightly pointed out, we say that we have extended a number of facilities, but where is the monitoring? Do we really know that these facilities are actually being extended to them? This is where I think community-led monitoring is very, very important. And this is something which has been successfully done in the case of HIV way back, because wherever the communities are active, you can have very good monitoring of the program. And unfortunately in COVID, we didn't involve the communities the way we should normally when there is such a huge emergency which has come in. So for me, I think reaching the facilities to the most deprived people and putting access before coverage. I think coverage is very easy to say. I have made 90% coverage, but the 10% who are left out are the most needy always. So I think it's always better to talk about access, and reaching health services to the last mile is the most important thing. Second is we have to bring in the programs into some sort of a convergence. Today we reach a number of services like silo programs. You have TB, you have HIV, you have malaria, you have leprosy, so many programs, and also reproductive health. And we have one common healthcare system. But all of them, they have their own budgetary streams, they have their own way of monitoring, reaching services, etc. And whatever efforts have been made to bring in such number of convergence among these programs has not been very successful. For the first time, I think we are making an attempt now. I find that the WHO has taken the lead, and the countries in this region, Southeast Asia region, have committed that they will bring HIV, hepatitis B and C, and sexually transmitted infections into one common system of governance, which is a good step. And I would say even TB should come under that. So if you bring some of these programs under a common governance structure, and if you see that the delivery systems are integrated so that the same person doesn't have to come again and again, once for TB, once for HIV, once for malaria, and things like that, then it becomes truly people-centered. And one more thing I want to add, thanks to COVID, even the testing mechanism that we have for various diseases, now it can be very nicely integrated, because the RT-PCR system which has come, earlier it used to be very costly and we used to have just a few centers in the entire country. Today, almost every primary health center in many cases have RT-PCR facilities. You can mount all the testing, whether it is for TB or for malaria or anything, on the RT-PCR platform. If you can bring in an integration into the testing services, you can see that the same person need not come again and again for different testing programs. So these are the ways in which you have to bring in integration of services. I think that for me is the true way you can bring in universal health coverage to the people of this country.
We're also joined in this discussion by Uttara Bharat Kumar, Senior Technical Advisor for Social and Behavior Change, Johns Hopkins Center for Communication Programs, and the Bloomberg School of Public Health, and Ravi Bhatnagar, Director External Affairs and Partnership SOA, Reckitt. So Uttara, coming to you, it was interesting that he was mentioning diseases like AIDS and TB, and which are the communicable diseases. And you've worked a lot in the field of HIV, and you've done that in Africa and India. So going forward, we know something like HIV today, AIDS today, because you have retroviral drugs. People can actually live with HIV for much longer. Earlier, if you had HIV or you had AIDS, it was like a death sentence. So we've made that kind of progress. But the gap seems to be in people getting to these drugs. So some countries have access, others don't. So what do you see as these kind of challenges in the future, since you work in this field of public health?
Sure. Thank you for that question, Swati, and thank you for having me on this panel. It's a delight to be here in this company to talk about behavior, which is my a passion. If we think about the future and where we'd like to be, we want a society that has diseases like HIV, communicable diseases like TB, and so on under control. And when we think about that, there's the medical side of it, and then there's the behavioral side of it. So you can't achieve one without the other. So we can keep bringing treatment to people and people to treatment, but until you work on prevention or early treatment seeking, there's going to be a serious challenge. We're always going to be out of resources. Our health centers are going to be overwhelmed, and something like COVID will come along and overwhelm the system even more. In countries like Africa, they struggle already to provide basic health services, and then when you add COVID to the mix on top of the HIV, it overburdens the system that can almost shut down. More than half of the diseases that people come to hospitals and clinics for these days are preventable by behavior. So we have clinical, we have policy, and then we have behavior, individual, family, and community behavior. And how can we address that? So my question is, when we think about best medical care, we want the best doctors. When we want the best kinds of policy, we get the best policymakers. So when we want to change behavior, why don't we get the best behavioral scientists and the people who know how to do that? And design strategically, fund those programs, and make sure we invest in prevention. Because there's prevention, there's also early treatment seeking, and there's adherence, all of these behavioral aspects will reduce the burden on a very overburdened health system. So things like HIV, which you're talking about, we keep on putting more people on treatment, but how about preventing people from getting HIV? We're forgetting the prevention side even as we talk about the treatment side.
It's so important talking about behavior, and I think what Amitabh's questions just now were just spot on, really good, because I'll give you an example. Tech and behavior. We travel around villages all in every state. And one thing we found that the tech is working much better, that, for example, many villages, widows are given 1,000 rupees a month, which is like a godsend for them. But all of them, when we talk to them, the behavior, when they go to the bank to collect 1,000, the teller wants 500. That's the behavior of the teller. So many told us, so we took one or two to the bank. And we asked the teller, why did you take 500 from this old lady? It's 1,000, you know, she's so poor. What kind of behavior is that? He said, speak to my boss. He wasn't in the bank, we tried to, the line cut gaya. But that's what's happening. The tech is working, but then the behavior of how do you make sure that they get that? And that's what you said. Yeah. It's good to talk to the recipient. Did you get that?
There's no respect, I'll tell you. Yeah. The example that Dr. Roy has just given is so pertinent. Just because you come from, pardon my language, a lower strain of society, right, you're looked down upon. You can stand in the queue, you go to the teller and say, baad mein aana. Yeah. Or udhar jaake khade ho. That poor lady has probably traveled miles to come to this, to collect her due. It's her due. Yeah. She's not getting her due. I mean, this is ridiculous.
You're making a very important point, which is about social norms.
But this is not just in this sphere of life. It's happening everywhere.
Everywhere, yeah.
So individual behavior is shaped by social norms because, you know, it's what is acceptable. How long do we say that's okay? And as long as we say that's okay or that's not okay, an individual will continue to behave that way. Take domestic violence, for example. People think that it's okay to beat your wife because that's the social norm. If you're a man, that's how you show control. That's how you show love. And the women themselves sometimes when interviewed will say that if he beats me, that means that he loves me, that he cares. So this is a social norm that's been created. But if you actually interview individuals, they'll tell you that not many men beat their wives. So it's what is considered a social norm, what is expected, what people think happens versus what actually happens. Right?
That determines behavior.
We need to shape that and change that to change individual behavior.
So Ravi, you know, when we spoke to the Manipur CM, he mentioned HIV, he mentioned TB, and Reckitt has sort of now partnered or is in Manipur working with the Prime Minister's scheme for a TB Mukt Bharat, in a sense. You know, why are we struggling so hard with TB in a sense? You know, especially in India, because it's multi-drug resistant. And the reason it's multi-drug resistant is because there's also, speaking again of behavior and discipline and control, we don't seem to have that when it comes to taking the medicines we're given or taking it right, or we over-medicate, or there's so much contamination in the food and water with the medication that we become multi-drug resistant. So how is this working, and you know, how is Reckitt with the TB Mukt Bharat, like where is this going?
Thank you so much, Swati, for asking this question. First is the geographies in the northeast. They're quite complex. Second is like, you know, like Mr. Bachchan was just mentioning about, you know, frontline health workers swimming, going for a huge distance, delivering polio vaccines. This is almost same situation in many parts, especially in the hilly regions. Government really wants to do something. They have public voices which are very strong. A voice for hepatitis, voice for smallpox, voice for polio. Many times the voices come like the medical voices, which are very difficult to, you know, translate to the common citizens or to, you know, everyone. So it's important, like there's more engagement, there is more airtime, there is more GRPs. What government actually gives to the public service messaging, more in the regional languages and not just in Hindi and English. Like we do work in most of the tribal districts in India where the real need is on the Human Development Index. In Maharashtra itself, like there are people who speak, Bhil and Pavdi in Nandurbar and Amravati. When the intervention started, we thought Marathi will suffice, but that's not the thing. So behavioral nudges are very important, which should be culturally adaptive. And it should be basically a part and parcel of the communication package which is getting delivered. On your second question, Swati, on the TB part, TB, HIV co-infection is something which is not new. It's been for a while. I have worked on the NACP1, National AIDS Control Program, phase 1, 2, 3, led the big interventions, worked on the price control for the ART medicines when I was with the Clintons in my last assignment for the Asia Pacific. I was heading that. So the basic question is basically, how much efforts are actually going into that? Because both departments were seen very differently with a global fund CCM mechanism now. And, you have the NGO sector leads like Plan and Path and many others. They're playing a very important role to bridge the gaps, which were the intersectoral gap between the Ministry of Health, the RNTCP, Revised National Tuberculosis Control Program, and the National AIDS Control Program. There were two programs running very parallelly. So now the convergence which is happening by the virtue of the country coordination mechanism and how the Global Fund has actually put the task forces in India, that's changing the landscape. I'm very sure with organizations like Plan who are actually covering whole of India almost for the TB, HIV co-infection and many other things. So we are going to see the good days. And most importantly, ma'am, like you have just mentioned, important is like how we stop the new infections. So new infections needs to be stopped. Yeah, thank you.
All right, Uttara Ravi, thank you very much. Also Mr. J.V. Prasad Rao and N. Biren Singh for this discussion and putting this thought in perspective. And now for BSI First, Banega Swasth India Think. A take on health from a different perspective, math and health. What's the connection? How does it work? To tell us more, Neelkant Bhanu Prakash. He is known as the world's fastest human calculator. Some even say he is to math what Usain Bolt is to running. I would like to welcome and introduce Neelkant to come on stage, please. He's going to stand there. Yeah. Sure.
Come and sit here.
No, sir, thank you.
He'll stand in front of the screen.
Okay, then you answer the maths questions. Yes. Amitabh, you answer the maths questions.
So the Neelkant Bhanu Prakash's superpower, as they say, is that he is a human calculator. He is a human calculator. आपको अगर कुछ नंबर दे दें, भानु आपको कुछ नंबर दे दें तो आप उसको तुरंत वो काम कर देते हैं जो कैलकुलेट आप खुद ही क्यों नहीं बता सकते अपने आप बता दीजिए अपना हुनर
So if you've heard of Shakuntala Devi madam, so I broke a bunch of her world records to be named the fastest human calculator.
Wow.
A few of this is to actually do multiplications which are extremely big, additions which are extremely big in your mind. Quick example would be आप एक 2-digit number choose करिएगा. Anything between 11 and 99.
Sure. And am I supposed to tell you?
No. Yeah, tell me the number. Yes.
Okay, 38.
38. So what I'm going to do is I'm going to add 38s to 38s very quickly in my mind, and I'm going to say the answer out.
Okay.
And it's going to be 38, 76, 114, 152, 190, 228, 266, 304, 342, 380, 418, 456, 494, 532, 576, 086, 646, 684, 722, 760. And that is to add quicker than the speed of a calculator. Thanks a lot.
Fantastic. Fantastic. Anyone else wants to try? Maybe ask him to multiply.
We need a calculator, then we have to like punch it in and then ask him the question.
27 into 45.
Oh, that's fairly easy. It's
What,
1 to 1
easy?
5. That's 1 to 1 5.
Huh?
That's 1 to 1 5.
Yeah, 1 to 1 5.
Why are you telling me? I knew about it.
What? That was bloody fast, I must say.
Thank you.
Ooh.
I believe, Bhanu, you have a presentation.
Yeah? Yeah, sure.
Yeah, sure, please.
Yes.
Cool. Hello, everyone. I am Neelakant Bhanu Prakash. titled The World's Fastest Human Calculator, as mentioned. I'm honored to be a part of season 9 of NDTV's Banega Swasth India with the goal of Lakshya Sampoorn Swasthya Ka this season. It's time to remind ourselves of how we are all interconnected with each other, and every little step of ours towards a healthy life has a compounding effect. Despite all of us coming from different social, cultural, and economic backgrounds, we all can agree on the fact that India should work towards becoming a healthier society. And India, being the country of young population, it is imperative that our collective goal should be on building a healthy and nutritious nation. Being a mathematician myself, I always work with numbers day in and day out. Today, I will use some data to share my views on how we can ensure a healthy next generation, what are some steps which we could take, and how can we look at the problems at hand. When I say mathematics has answers to everything, math also has the answer towards making our country healthy and prosperous. Math actually helps you see the bigger picture and even predict the problems coming your way. A little numbers at you. 4,500 children under the age of 5 die every day in India due to hunger and malnutrition. A little math on that, that is approximately 16.5 lakh children every year, and that is one child every 20 seconds. These are those lost lives who could have contributed to our future society, and we are often really mindful of our health and the people we care about. But we often fail to realize that health and wellness through a wider lens. Math helps us with this. Math and data helped our country fight the COVID-19 pandemic. How I would say through the data-driven decisions on vaccine deployment, and guided the entire country deploy health resources, or at least find more efficient ways of doing so. With the help of mathematical modeling and predictive modeling, we can decide where to focus resources in ways that benefit individuals as well as society as a whole. While short-term measures can show incremental results, I believe that in long term, India can only eradicate hunger and malnutrition by finding solutions not just from the policymakers, but from experts in every single field. 6.4% of India's population today is under 5 years old. And it's our responsibility to keep those children healthy. Access to nutritional and healthy food will reduce their chances of contracting chronic diseases and improve their life expectancy. In 20 years, these very children will comprise 50% of our nation's population. Targeted efforts towards the health of the children today will ensure that by the time India celebrates her 100 years of independence, our great nation would be 100% ready to take India to the next century. And last but not the least, it's important to understand the role data plays in prioritizing what are the problems to solve, and the zoomed out understanding towards looking at a healthcare problem, looking at malnutrition, looking at hunger as a problem, can be solved, as mentioned, not just by policymakers, but with mathematicians like me, with scientists of today, and with technocrats of today. And saying that, I would say Banega Swasth India, and Jai Hind.
Thank you. Thank you so much.
Very well
Can
put.
I ask
Very
you a
well
quick
put.
calculation?
Sure, go ahead.
I need the calculator, but I'm just going to ask you.
Yes.
So if we multiply
Let's ask him, how many numbers can you calculate?
everything, he's the human calculator.
I mean, you can do whatever.
Yeah. So I'm going to give it a shot.
Okay.
So
This is a difficult one.
no, it's not. Not for you, I don't think. So what if 88,596, yeah, is multiplied by 58,000?
Oh, that's going to be big. That's going to require a board.
It's going to require
That's
a
going to
board.
require a board.
So what if you do 8,800? So let me just change this really quickly.
What I'm going to do, ma'am, is
Yeah.
take a 5-digit number, like 88.
5-digit number? Okay, so let's do 5. Hang on, just without my glasses, this is very difficult. Change that, delete it. Do.
Maths is your strong point.
So, okay,
You're
do.
challenging the mathematician.
No, I'm looking at a calculator, so we know the
Okay, a
answer.
5-digit number.
Take a 5-digit number.
83542.
83542 multiplied by, give me a single-digit number.
Single-digit number?
Yeah.
9.
That's going to be 751878. And I'm going to multiply it by 751878. That's the answer.
Okay.
Yes. And
I
I
have
can.
no way to check
Wait,
this, but
I can.
great stuff.
Yes.
It's right? Fantastic.
Yes.
Fantastic.
And you can go on and on. I mean,
That's
yeah.
amazing.
Thank you. Thanks a lot.
Fantastic.
Amazing. Just like you.
Thank you so much.
Thank you.
Well done. Thank you.
Thank you very much. Thank you.
Good God.
All right, let's stop for a short break at this moment. We'll be back and our broadcast continues. Stay with us.